Thanks, everyone, for joining us on another episode of our podcast, The Canadian Breakpoint. So today we're doing this new thing. I've never done this before. We're doing an AMR series, and it's going to be fantastic. We're talking actually from the symposium here in Toronto, and we have a lot of good speakers, a lot of different perspectives about antimicrobial resistance. And so today we have Ms. Huda Razzak, who is here with us to talk about antimicrobial resistance and really have a focus on stewardship and more from a personal and patient perspective. So welcome, Huda, and thank you so much for joining us today.
Thank you so much for having me. I'm so excited.
Yeah, awesome. And so why don't you let our audience know a little bit about yourself and what brought you to the symposium today?
For sure. So I do have cystic fibrosis. It's an infection, a genetic condition.
Yeah.
That causes a lot of infection and causes a lot of thick mucus. So I'm not a stranger to bacteria. Bacteria is always growing. There's always something going on. And I'm always taking antibiotics of some sort.
Right.
So really not for the basis of most people where they go get antibiotic to get cured and it's over and the story ends. For me, the antibiotics is really just when I can't fight on my own anymore, when the base treatment doesn't work anymore.
Right.
I do antibiotics in the hospital to give me that little boost so that I can go back to doing what I do.
Okay.
So I do have this genetic disease. I'm also a dietitian. I graduated from McGill in Montreal, Quebec.
Wow. Fantastic.
And so I do dietitian as my job in Montreal. I'm based from there.
Awesome.
And I also do a little bit of reception work that I like as well in the same clinic.
Okay.
And then when I'm not doing any of that, I do also drug testing. So I get to do like rapid tests for employees who are about to start for like drug testing or alcohol testing or things like that.
Got it.
Hearing testing, all of that. So those are really like, I'm busy.
Yeah, you're busy.
Yeah,
especially with having kind of a condition like cystic fibrosis.
Yes.
It is more chronic. Sometimes you're away from probably work for
a while.
Yeah.
And it's tied into why I care about this so much is that can we reduce that amount of time that I'm there?
Yeah. And that's a really good point that you bring up, because whenever we think about antimicrobial stewardship and resistance developing, we kind of always think about appropriate use of antibiotics, but there's also another kind of angle to it is how long we're using these antibiotics, right? So starting the antibiotic, which one it is, if it's the right one. And obviously for you, I'm sure when you look at your kind of susceptibilities come back for the organisms that you normally grow, you probably also worry, like, am I developing resistance and what's happening? So
absolutely. Yeah. So we're a little bit beyond worry. I don't want to make this too depressing, but I do have only a couple of options left. I do carry multi-drug resistant bacteria already. We're kind of already there.
Yeah.
And it does have a lot to do with why I'm here and why I'm so passionate with this topic of antibiotic resistance, is that I don't think it's something people think of as being so imminent.
Right.
Unless you're living through it, which I am, or someone who is.
Exactly. Yeah. And so how do you feel like the impact of kind of the resistance, like over the years, has been for you from a quality or, patient perspective standpoint?
Question, because it used to be that I can go to the hospital, get oral antibiotics, get discharged within like minutes from that.
Yeah.
Take it and it works.
Right.
And it's great. You move on, you go back to school, you go back to your studies.
Yeah.
Everything's fine. It doesn't do anything.
Right.
Right now, oral antibiotics don't work for me anymore. They're not strong enough because we've used them. My bacteria is resistant to them. So that's one thing. I can't go with an oral antibiotic anymore.
Okay.
The other reality is that I can't even go with one IV antibiotic anymore. It has to be 2 at a time. And I'm kind of left with 2 options.
Yeah.
So it becomes a lot harder that you start questioning if I'm even going to go to the hospital. That's where I'm at right now, is asking, is it worth to go to the hospital?
Like, am I sick enough that I need to go
today,
tomorrow, or the next day?
Exactly.
Yeah.
And that it might just mean that taking antibiotics now could potentially reduce my ability to use them next time.
Right.
Because of resistance.
Okay. And so what's the message that you want to send to our listeners today?
If we can work on, using the faster diagnostic tools that companies have created, and it is available, if we can use to diagnose quicker, to avoid unnecessary antibiotic use when it's, for example, viral or it's fungal or something else.
Yeah.
From a patient perspective, also to not want that. I think we tend to go to the hospital hoping for a prescription.
Yeah.
At the end of the day.
Right.
And we do have to realize that what we're asking might end up hurting us with resistance. The more antibiotics we use, the more bacteria gets used to it and gets resistant.
Right.
That's just the reality
behind
it. So a little bit of quicker diagnostic would be my dream.
Yeah.
Having that discussion with the doctor about the risks and the use of it.
Right.
To really sit down and talk about that. Yeah. To make that decision together.
Yeah. That's a fantastic point. I think it's really important to kind of really bring out the idea that sometimes if you do have a cold, that type of thing, you not need antibiotics because it's not bacterial, it could be viral, and really looking at it, not how it's going to make me feel better today, but in the long run, long-term outcomes and the consequences if I continue kind of taking those antibiotics and building that resistance.
Yes.
Yeah.
Exactly.
It's a really good, important point. And I think even with the Antimicrobial Resistance Symposium that we're here today and over the next 2 days, there's a lot of talks around resistance, and not only that, having some diagnostic stewardship, what you mentioned in terms of relying on some rapid tests and communicating, I think, is really important in reducing that barrier within even hospitals that, we don't know what's available. And so talking to the microbiologists about that is really important as well. And knowing what your hospital can provide. And if they can't, for instance, and not just in hospitals, I think in community center settings too, like acute care settings, we also do need that as well, where we know which tests that we have and what's available to kind of help us distinguish between bacterial, viral,
or fungal.
Or fungal, exactly. Yeah. And it's, we've never done it from a patient perspective. So I think it's always important to kind of see the other side, right? And you're seeing it from kind of, the next antibiotic, whether it's going to build more resistance. And then, you're worried, not only are you worried when you're going to the hospital, am I going to have to stay here long enough? Have I built more resistance?
Right.
And do I have options to treat?
Right. Because the question right now is I don't know.
Yeah. And it's very frightening, look at it from a physician standpoint, it's also like frightening because you want to support the patient and you want to help them.
For sure.
But living with it and then knowing kind of which options you have and you don't have, it would be, I can't even imagine.
What's worse of it is that the last 2 antibiotics I was on that were sensitive to my bacteria, so we're all happy, yay,
Yeah.
I ended up having a really scary experience while on them, where I had a massive lung bleed. Oh, wow. So my lungs were just bleeding nonstop. The nurses couldn't stop it. Like, it took a lot of effort.
Okay.
So you come and you're thinking, these are the last 2, but look at the risk.
Yeah, exactly.
Look at how you feel on them, is that you're getting close to that lung bleed. Right. Now, it's not directly because of the antibiotics, but it's just being on those 2 and feeling that really makes you wonder, is there better options with maybe less risk? Yeah.
And you bring up a really good point. This one probably wasn't mainly directly related or a side effect, but there's also side effects to antibiotics and being on antibiotics and those types of things that I think in the moment when people are thinking about an acute, you just want to feel better.
Exactly.
But which sometimes, which is fair. But sometimes in the long run, that is not going to benefit you.
Right.
Unfortunately.
Right.
And so
that's why I'm here. That's why the AMR speaks so loudly for me, is because I am there. I am at the point where I understand how imminent this is. Yeah. And if there's anything I can do to create that awareness for anyone to realize that maybe we do need to talk more about the use of antibiotics and faster testing and all of that.
Yeah.
That's really the goal.
Yeah.
It's not about finding options for me. It's realizing that resistance is going to affect everyone.
Right.
If I cross with someone else who has CF, I can give them my resistance.
Right.
And all of a sudden they're down of options without
Right.
even going on it.
Right. Yeah.
So it is
So it's
a little bit of a
Sure.
silent threat that we don't realize.
Right. Yeah. Yeah. And it's actually quite alarming how this has progressed, and like resistance has progressed over the years. And I think we always talk about this and how it's caused deaths and diseases to become more challenging to treat. And so thank you so much for bringing your perspective. And I think most of us here at the AMR Symposium share kind of the same passion as you.
Yeah.
Obviously, we're not going through the day-to-day challenges that you are. So you're very brave. So thank you so much for bringing out your story and telling us a lot about kind of how this affects you directly. And we hope that with this awareness today, with you coming on the podcast, with us being here live today at the AMR Symposium and talking to experts and researchers and clinicians, that all of us can kind of work together to really combat this issue.
Yes, well said. And I think not only work together, but have that discussion together.
Exactly.
That you as a patient, when you go to the hospital, to be empowered to know that this could be an issue. And what are my options, and open that discussion. And you can you don't have to be a sciencey person. You don't have to be a doctor.
No.
You can just bring it up to your doctor about what about resistance, and is this the right thing for me?
Right. And thank you so much for bringing that up, because I think it's really important as kind of being a patient. And I recently had, some exposure of being kind of on the patient side with my dad and him going through an illness. I can't even, it's such an eye opener sometimes when you're on the patient perspective side, and how many things that you have to think about. And sometimes you don't know the questions that you have to ask. So I think, thank you for telling the audience that, it's okay to question things. It's okay to ask about your care, to ask if you have fears about an antibiotic that you're going to be put on to, and I always tell parents about the resistance that can develop and all that. But I feel like it's really important that families advocate, or patients advocate for themselves too, and bring this up. And so I think you're a key example of someone who for sure does that. And it's fantastic to see from my perspective as well, to see that you're an inspiration to others that have chronic conditions, but also just going in for a common cold. And they should think, do I really need this?
Exactly. Yeah.
So it's been
so just to bring about the conversation. That's what I ask of everybody.
Yeah, that's great.
Start talking about this.
Yeah, and I think start talking is probably a good approach to create the education and awareness as well, because then in that moment, the physician themselves who is about to prescribe probably also has to think, is this the right choice?
Right.
Should I make this choice today to give this patient a viral prescription or a antibiotic?
Yes.
And I think there's a lot of different methods that we've kind of brought up with stewardship, and a lot of different techniques that we've figured out. And I think there's a lot of discussion around this. So yeah, I think we'll all continue to get better.
Yeah, I am hopeful. These events do bring about the hope.
100%. Yeah. And they bring about action. So that's what we're here today for.
Exactly.
Awesome. Well, thank you so much, Huda, for coming onto the podcast and supporting the podcast. And
thank you so much for having me.
Of course. And we wish you all the best.
Thank you.